online.org. Well, with that, I always start the show, or try to start each edition of the show, with an Aesop's fable. So that's slide number 0. Is there such a thing as slide number 0? At any rate, so if you take a look at slide number 0, the fable for tonight: the hawk, the kite, and that's another kind of bird, and the pigeons. Well, the pigeons, terrified by the appearance of a kite, called upon the hawk to defend them. He at once consented. When they had admitted him to the cote, they found that he made more havoc and slew a larger number of them in a single day than the kite could possibly pounce upon in a whole year. The moral of that little story: avoid a remedy that is worse than the disease. Amen. Well, with that, I am very pleased to introduce the guest to this edition of My Fellow Idahoans, Stephen Reames. Stephen, welcome to the show.
Thanks for having me, Jim.
And you are the executive director of a 501c3 charitable organization in Boise, and it's called Genesis World Mission.
It is.
And located in Garden City.
Garden City, Idaho. It's the center of everything right now.
Genesis World Mission. Now, that doesn't tell me what Genesis World Mission does. Steve.
Kind of vague to be on purpose there. Well, Jim, thanks again for having me, and worked with you for the past couple of years on some programming that we were doing. And, well, our goal: inspiring healthy communities everywhere.
Is the operative word healthy?
Healthy's good. Inspiring is good. Everywhere is good.
Very good.
All those words, really, you know. And you know that, hey, that sounds like a computer on every desktop, right? You know, even though we know Bill Gates didn't really say that. It really is about what can we do as a people, however big or large, small we are, is to inspire health, inspire healthy communities, and to do that as many places as we can. So even though it sounds audacious, I mean, I would say, you know, is it far-fetched for us to think that it's not just a desktop in every computer now? It's a computer, a desktop in every computer, a computer in every pocket, your cell phone. I mean, 76% around the world, people carry a cell phone now. So this is not an audacious goal for us to think that we could get a healthy community in every single community around the world. Totally possible. That's my belief anyway.
So where do you have operations right now? Do you have facilities?
Sure, we do. We have a facility down in Garden City. We've been there for 10 years. Actually, this month marks our 10-year anniversary of the Garden City Community Clinic. It's one of our flagship projects. We started 10 years ago with that project. And
so clinic.
It's a clinic. And
as in health services?
As in health services. And I'll talk about that. And then just kind of real quickly around the world, we're also doing community health initiatives. So we've taken what we've done in our own backyard and said, and there's other needs around the world, and we've taken that overseas and tried to implement that in other places. So yeah, let me tell you about that. First of all, Dr. Karl Watts is our founder and president. A lot of people know him. He's kind of a local personality physician, and he's been involved in a lot of political things, the Governor's Commission on Health Care, for example. He won the National Family Physician of the Year award a couple years ago. So he's our founder and president. People know who he is, and they go, oh, Genesis World Mission. Now I know what you're talking about. Well, for those who don't, and we get this all the time, I never knew you were here. How come you guys don't tell more people you're here?
Well, that's what we're doing tonight.
That's what we're doing tonight. So the Garden City Community Clinic, we are a nonprofit organization that provides health care to people who have no insurance. And the way that we do that is we get volunteer health professionals involved in providing mental, dental, and medical care, as well as prescription assistance down at the clinic in Garden City. And in fact, we have some slides, if you want to throw those up there, to kind of show you our facility. We're pretty excited because we turned this glass warehouse into a clinic about 10 years ago, and now it's on 35th Street. I call it the miracle on 35th Street. And so realistically, this thing is a miracle, and every day that it runs, it just blows me away how generous people are with their time and with their efforts. So the clinic operates all week long. Our medical services are 3 days a week. Our dental services are 4 days a week. Our mental health services are throughout the week, and all that really kind of depends on volunteer availability. But our goal is that we provide a place of compassion and quality for people who are in just desperate need. Let me tell you a story. We have people that come in all the time who are working their tails off at work, trying to make ends meet, trying to feed their kids, trying to put food on the table. You know, they're working desperately hard, and for whatever means, whether it's lack of education or lack of full-time employment, they just can't make it seem to work. So we've opened up our clinic to them. They come to us. They come in, you know, maybe ostensibly because they've hurt themselves, or because they have diabetes and they have no other place to go, or maybe they have, you know, more of an acute condition going on. And so we begin to care for them. And then our social worker and our counselor sits down with them and says, now, besides your medical help, we want you to know, because we know you're stressed out, you're depressed. Some people come to us very suicidal, and they say, we're going to take care of your medical needs and your dental needs. We're going to provide some counseling for you, some spiritual care if that's what you want. We're going to get you prescriptions. We'll get your referrals to specialists, and we're not going to make you drive all over town and fill out a whole bunch of forms at different places to get that care. Is that going to help you? And this is what happens. People go,
yeah, I bet.
and the weight of the world just comes off of them, because they're like, wow, somebody loves me. Somebody's going to care for me. And I'll tell you, Jim, you and I probably have pretty, you know, reasonable, maybe average insurance. These people are really getting great care, because as a clinic, we're all donation-based, so we really don't have to bill anybody for the service we provide. We're going to do absolutely what is needed for that person's care, whatever it takes. And so we've arranged a whole network of people who are willing to step in, specialists and labs and radiology and surgeries, and you know, we put all those resources together so that whatever we need to get to that person to help them out in their situation, they have access to that care, and these people are just blown away in gratitude.
That's impressive. Absolutely impressive.
It's a lot of work, but it's a lot of fun.
Yeah, amen. Well, let's see. Do we have a photograph of this place?
Yeah,
let's see.
if we can throw that up, you can
Nick,
kind of
do you
see
want
our
to show
clinic
us
facility.
some of the
we're down
slides
here
there?
in Garden City,
There.
you can see. We refurbished that 10 years ago, and now it's operating. It's about 3,000 to 4,000 square feet of clinical space. And you know, if you look at the waiting room, the next slide, you see, you know, we try to make it a very high quality place. This is a very welcoming environment, and so we want people to feel like they're not just getting the leftovers, but they're getting quality care.
So that's like 10% of your space
Yeah,
is the waiting room, and
this
then
waiting
there's
room,
everything.
and then there's everything else.
to the
so
right.
you can go through, and we have, you know, doctors and nurses and
Go
nurse
ahead, Nick.
practitioners, and that's
There's Dr.
Watts, yeah, our founder and president. He still comes and volunteers pretty frequently at the clinic. He's involved in a lot of initiatives on a city and kind of state level and regional level, and so nurses, doctors, dentists, counselors, you know, just a whole gamut of people who put this care together. And a lot of people ask me, how many hours are you open for clinical service? I say, you know, that doesn't really matter how many hours we're working, because we're working all week long to coordinate care. And I really need people to understand this is an integrated health facility. It's not just one thing. You know, it's not just about being in front of the doctor at any one time, or being in front of the counselor or the dentist at any one time. It's really about all of the care that we're bringing around people. And when we treat people as body, mind, and spirit, there's a holistic way that we're going to approach this. And that's the last slide. That's our counselor. What they realize is, whoa, my health is not disassociated from my mind, not disassociated from my mouth. You know, your mouth is part of your body. If you have an infection in your teeth, you have an infection in your body. And so people who are diabetic need to understand that the way you take care of your teeth, people who are pregnant, you understand, the way that you take care of your mouth, it affects your whole body. So it's that holistic mentality that I think that's somewhat unique, I think, the way that we're trying to approach healthcare. You don't find a dentist in a doctor's office, right? You don't usually find a mental health counselor in a dentist's office. You don't have them giving prescriptions out. So I think that there's a very unique gift that we're able to leverage for the community. It's pretty exciting.
Yeah, okay. Now to give our viewers just kind of a feel for kind of volume, I mean, how many people are you kind of helping in a year or a month, or, you know, some kind of...
Sure. That's probably real helpful. Last year, this is pretty exciting too. Last year, Ada County Commissioners helped us out with some funding. We're very glad we were able to add a nurse practitioner and a counselor, both half-time to our staff. And some
Oh, okay.
So we went last year, get this, from in October of 2011, from 485 patients, annual patients, to this past year, 800 patients in 12-month period.
You saw 800 patients.
So we went
wow.
all the way. You know, so we're just totally, as we always are, just kind of straining at the oars, trying to keep up with all the work. But that's an amazing amount of growth for us in terms of the care that we're seeing. So, you know, medical, they'll see a certain number of patients, dental, you know, so it's all based on how many hours or how many units of service they can see in a particular amount of time.
Are they referred to you from other places? I mean, how do they find out about you?
Yeah, probably the biggest referral is the emergency rooms.
Oh.
Yeah, you know, if you're uninsured and you have a medical issue, where do you go? you go to the emergency room,
Absolutely.
right? Because federal
Absolutely.
law, they've got to pay for this care, or at least they
got it.
cannot deny you care. You're still going to get the bill, but they're not going to deny you care. So we're on the discharge planning with the ERs, and that's a good partnership, because then our goal would be, let's keep these people out of the ER in the first place by getting some of this preventative care. For example, if you have a toothache, you know how excruciating it is. You
I've
can't even
been there,
function,
yes.
right? So if you have no dental care, you go to the dentist, they go, well, you know, you don't have insurance, it's going to be $300 on the table before I open your mouth. Not going to happen, right? So you're going to do whatever you have to do to deal with that. Well, people's faces are blowing up in infection, you got stuff trickling down your throat. It's not a good situation. They go to the ER. The ER are not dentists. They're going to give you some painkillers, they're going to give you some antibiotics, and they're going to send you on their way. And 3 weeks later, where do you think that person's going to go for dental care? Back to the ER, you know? So these are the kind of situations that we're trying to interrupt and say, okay, cyclically, this is just stupid. Why are we doing this?
Right.
And we're trying to break that repetitive flow of people into the ER by really getting them the preventative care that they need, either by dealing with that root cause, no pun intended, of the situation, you know, whether it's dental or otherwise.
So now you mentioned that the caregivers, doctors, you know, et cetera, are volunteer?
They're all volunteers. We have about 200 or so volunteers during the year.
So surgeons?
Well, there's a primary clinic, okay? And so that you bring up a great question. What happens when you go beyond what a primary family doc can do, right?
Oh, okay, yeah.
So besides dental and things like that. So what we do is we've set up another thing called the Volunteer Physicians Network. And that's a network of about 300 specialist physicians, labs, radiology, and hospital services.
All here around Boise, Nampa?
In the Treasure Valley. In the Treasure Valley, yep. All of the Treasure Valley. And so we've lined those up. And basically what was happening before is clinics like ours, or the Canyon County Community Clinic, or the Family Medicine Health Center. These are all clinics that serve the same population as us, whether they're free or sliding scale. And you know, every doctor had his black book. Well, I need to get a dermatologist, or I need to get a cardiologist, and I got a friend that I graduated from residency with, so I'll give him a call and see if I can do a favor. Well, once he does one favor, then it's another, then pretty soon he's the charity doc, and that system wasn't working for anybody, not for the doctors, not for the patients, not for the specialists. So what we did is we put together a big black book of guys who are willing to donate their services for free to these kind of patients, and what we do is we qualify those patients through our system for eligibility, financial eligibility, and then we broker those appointments out to each of those clinics. And all they do is they go, oh, I need that one of those appointments. They give them a referral sheet. The person goes off to the specialist, dermatology, cardiology, rheumatology, you know, any of those ologies, or radiological services, lab services, and in some cases, hospitalization in terms of surgery. So, for example, gallbladder explodes. You go to the emergency room, yeah, I got to get it out, $55,000. Or maybe we could do this preventively and it would be only $5,000 or $6,000.
When you say preventatively, do something
Before
before
it
it explodes.
Yeah, exactly.
I was going to say, now wait a second here.
So, you know, we tell people this and they go, how could it be so much more? Well, when it's an emergency and you're dealing with a mess. And so these are the kind of things that we're trying to do by saying, look, this guy's going to end up in the ER eventually. Let's just get this taken care of now. We work with the hospitals through the financial eligibility. We hand off all the paperwork, all the documentation to them. Sometimes they go to the county or to the PCIP fund. They have to do that by law. And then if they get that covered there, then it's paid for. And if not, then they write it off as charity care rather than sending it to collections and it being written off as bad debt. What's smarter, charity care or send it to collections, call the person, beat the person up, pay the collections agency, and then write it off as bad debt, you know. So we're trying to help the hospitals out by streamlining the charitable things that they're already doing. And the hospitals really, they do a lot of charity care, more so than most people know. They really do give away a lot back to the communities.
Very interesting. Now, so the volunteer, I guess you'd call them more like the primary care?
Yeah,
Is
primary care
that's
doctors,
what
family doctors, yeah.
So those people are, again, those doctors, those healthcare professionals are from Boise and Meridian, and they're just all around,
Yeah,
and
kind
they
of all
come
around.
in, and they might do, you know, an afternoon,
Yeah,
a week,
exactly.
a week
Couple
or
hours,
a month.
You know, a lot of we have some anchor docs that are there every week for a couple hours.
Oh.
We have our nurse practitioner on staff, and she's obviously been the one that's helped pick up a lot of the load for this past year. But you know, we have between 14 to 18 doctors. We have 9 to 10 dentists. We have 5 or 6 counselors that are sometimes already licensed, and sometimes they're finishing their practicums and master's degrees. from Idaho State University or from Northwest Nazarene. So we work with kind of anybody and everybody who's qualified to do that. And then there's, you know, a bunch of administrative, a lot of pre-med students. If you're a pre-med student and you want to get something on your resume, come on down to the clinic. That's a great place to do some service hours. We got people, and they can't get their hands on patients, but they can work in the med room. They can work on eligibility and financial screening. They can work at the front desk. So there's really a lot of opportunities, and it looks pretty good on your application to say I worked in a medical clinic for the uninsured.
Yeah.
Interviewing for medical school.
No doubt.
Yeah.
Very interesting.
Yeah.
So, okay. Now, your facility. Now, you mentioned dentist. I mean, if you need a root canal, do you have all the equipment that you need to do all of that?
Or? You know, our dental, we focus, it's not really preventative in terms of dental. It really is restorative in a sense. Yeah. So we're talking about fillings, extractions, and root canals. And that's pretty much all we do. Now, we do some prosthetics where we're helping people, you know, if they're missing a full set of teeth, and we work with dental labs to kind of get some dentures or flippers or other things going like that. But for the most part, we're pulling teeth that are rotted out. I mean, we'll have people, I remember a case where we had a gal who showed up. Beautiful gal. I mean, she just a beautiful face. She would talk like this because she was very afraid of the fact that her teeth, she had 24 surfaces of her teeth, 24, that had cavities in them. And so, you know, here's a person who could totally get a job, but because she talks like this and she will barely open her mouth to speak because she's ashamed of her smile, she wasn't able to get a job.
Yeah.
So we were able to help her get to a place where she was ready to go back to school and really carry on with her life, even with just a couple of front teeth that she was able to begin to open up her smile, began to speak at a normal level of voice. It was amazing the kind of hope that she suddenly had to be able to just say, I feel normal again, I feel accepted again. And the amazing thing is, she goes, you know, people look at that and they think, oh, I probably did drugs when I was young, oh, I probably smoked marijuana or kind of whatever. And she says, no, you know what, I drank a lot of soda pop. And I was never told not to. And that was the problem, candy and soda pop, and it rotted her mouth out.
Wow.
So, you know, we're not just dealing with people who are sitting on their butts all day in front of a couch or in front of a TV on the couch. We're not just dealing with people who are in generational poverty. We're really dealing with people who just situationally, they just are having a hard time getting ahead.
Yeah, interesting. Very interesting. Well, there's this one case of a young food server. I guess we don't call them waitresses anymore.
Yeah, maybe not.
Food server. No insurance, no need.
Right.
Healthy, exercises, you know, et cetera. Out doing some mountain biking or whatever. Fell off her bike. Head, back, emergency room. A tube to drain fluid from her brain down her next to her spine or some craziness like. And she's back at work with a $40,000 bill.
Crazy.
So now, she didn't. Well, I mean, she was in the ER. They had to fix her right then and there.
No
I mean,
choice.
right. So, $40,000. Period.
Right. What are you gonna do with that?
So there's no role for Genesis in a case like that.
No, because I mean that's really after the fact. It's an emergency. It's not anything you can do.
Yeah, it's not like somebody who comes in, they've got a pain, and then oh well, fine, here, this is.
Right.
It's not something serious, acute emergency.
Yeah, 85% of what we deal with is chronic diseases. Diabetes, hypertension, asthma, depression. Those are the 4 biggest things that happen. And so if you think about someone who's not had care for maybe 3, 5, 10 years, maybe never in terms of insurance coverage going into a doctor, as well as dental, you know, oral health issues. If you think about that, and diabetes that's even gone unchecked for 2 or 3 years, eventually they're going to be in the ER, you know, because their blood sugars are going to go at some point or another, and so there's going to be complications. Or they're going to be losing toes because they haven't had their feet screened every year, or they're going to be losing their eyesight. So these are the types of things that are really driving up medical care costs, is the cost of chronic disease management. And so again, if we're not getting to these people preventively, where do they go? They go to the ER. Where does that bill go if they can't pay for it? It goes on your and my tab and the hospital's tab, and so everyone's sharing the cost of this. Why don't we do this on a preventative basis?
Right,
that's really what we're trying to drive at.
Now, Genesis World Mission.
You said it.
Now, Yeah, what else do we have going? Why is it World Mission? Why isn't
Well, you know, Dr. Watts,
Jennison Garden City Mission?
who knows? I mean, you know, it's always
Oh,
a marketing issue,
he named it.
But here's the problem. Yeah, he said, this is what God told me in the vision. So that's
very
what I named
good.
it. Well, what are you supposed to say to that? You know, so so World Mission. I mean, Dr. Watts in medical school, he went on a trip overseas to a South American country and.
South America, okay.
South America, maybe it was Central America, and he caught a vision. He caught a bug for it, and so he came back, finished his medical school, came to Idaho to do his residency in rural medicine, and then stayed in Idaho so that he could be able just to do that rural care overseas whenever he wanted to go. So he started this ostensibly so that we could do both the local side and the international side. So what we've done overseas is we started out as an organization taking a lot of short-term medical missions trips and sending equipment and supplies over. But now we've really settled into how do we help communities do the same thing that we've done for our community, which is provide a long-term, sustainable type of place for healthcare for people who otherwise can't access it. And of course, in another country like Kenya, where we work predominantly, that's going to look totally different than a free clinic. Because
did you say you work predominantly in Kenya?
Kenya is our nation right now that we're focused on.
Oh.
And so we have a clinic outside of Nairobi that we helped to get off the ground, and from 2007 to 2012 we helped financially to provide some sustainment for them. Now they're completely independent. So after 5 years of getting some ramp up money, they were able to get to a place financially where they receive service charges from their patients and take fees, and they're financially solvent. And so this is amazing because this isn't our clinic. We don't operate it. We don't own it. The Kenyans own it. It was their dream. All we did is come alongside and do some capacity building. So I want to show you some pictures from the current project.
Yeah,
this
please.
is really cool. Down on the coast of Kenya, there's a town called Mombasa. In fact, actually, there's the clinic right there outside of Nairobi. It's in a town called Doomberry, and it's a 6,000 square foot facility. They have 26,000 patient visits a year.
26,000?
Amazing.
And you're only doing 800?
Yeah.
Oh,
I know.
All right,
But,
moving right.
Let's move right. So the next slide you see, so here's Malindi district, and Malindi is one of the poorest districts in Kenya, and it's along the coast. So the village called Barangi, they really truly live in mud huts there. And as you go on to the other slides, you can just see the reason why. See that river? They have to cross that to get anywhere. That's on the south side of their village of about 5,000 people. It floods all the time, and so it's a real problem to cross. Crocodiles, hippos, boats flip over, people drown all the time. When it floods on the south side, it also fills in this dry creek beds on the north side so that people can't even get out, even if they're trying to go overland, and they can't even go overland.
Now, what is she going to do with muddy water?
Drink it, give it to her kids, because as many Western aid organizations have come in and drilled a well for them, and there's several, all the water is brackish because they live near the ocean, so when it rains, the water comes up. So they still get their fresh water there. You can see all the women, that's what we call Starbucks in Kenya. The women say, we'll never use those wells anyway, because this is how we get away from our husbands. Once a day we go down to the river, and so please do not drill another well in the middle of town for us.
Okay.
So this is why you ask people, and what we're learning is it's so important to engage the community. And our model is really about empowering people by engaging them. What are your needs? What are your problems? How do you think those should be solved? Not, hey, I think we're going to come in and build a clinic for you, or we're going to put a well in here, or we're going to give you, water for you. We have to really work with them to find out what they're going to be able to sustain. So that whole empowerment piece is a really big deal. One of our friends, Mark Russell, he is a guy that spoke at our annual dinner. He said, there's good charity and there's bad charity. And good charity is that which empowers the recipient, not that which makes the giver feel good. And I think a lot of times we've got our aid kind of messed up because we have the wrong attitude. And I think that empowerment begins with our attitude and the way that we structure services. And to that note, what we're learning overseas, we're trying to re-import and apply to our own clinic back here in Garden City. Because you know what, we don't have an empowerment model here. We have an enablement model. And so we're actually beginning to take some of those strategies of empowerment that we're learning overseas, bring them back to the U.S. and say, how do we begin to engage our patients and say, this is really your health, this is really your problem, so what are you going to be doing about it? And really begin, rather than just saying, take two and call me in the morning, right? Classic doctor line. It's really about, okay, here's some options. What do you think is the best route? What kind of plan do you have for your health? And what are you going to do? And what can we come alongside you? Do some capacity building, individuals, whether it's an individual or a whole community, rather than saying, we're the experts, we're the doctors, we're the Westerners, and then we begin to come alongside people. That's sustainable.
Yes. And what is sustainable as well is the fact that the community here in Boise, well, Treasure Valley, they support Genesis World Mission.
They do, very generously.
And so folks who want to take a little bit of ownership in Genesis World Mission can certainly jump onto your website.
Absolutely.
GenesisWorldMission.org.
Yep.
It's been on the screen for
They can
most of
also
the time.
hit Twitter, they can hit Facebook, they can
there
hit
you go.
all those different sources, and we have a slide that has all of those different things on there. They can volunteer.
Yeah, and you can put that slide up, Nick, if you want, that very last one, I think is there. At any rate, so you can contact Genesis World Mission, Garden City. Steve Reames is the executive director, has joined me on the show this evening. And I really appreciate it. It really kind of enlightened me. I knew you were kind of there, and that's why we were talking about it.
Yeah.
Before you called me for the other work that we did together, I had no clue you were there.
It's because we never spend our money on marketing. We're always spending it on programs.
On programs and helping people. Well, God bless you, Steve.
Hey, thank you, James. Really
Thank you for
appreciate
being on the
opportunity.
show, and we'll come and see you again sometime.
That sounds good.
All right.
Thanks a lot.
Good night, everybody.